Which of the following is the most common extraglandular manifestation of primary Sjogren's syndrome? A. Arthralgias, arthritis. B. Lymphoma. C. Peripheral neuropathy. D. Raynaud's phenomenon. What do you think is the correct answer here? Which of the following is the most common extraglandular manifestation of primary Sjogren's syndrome? A. Arthralgia. B. Lymphoma. C. Peripheral neuropathy. And D. Raynaud's phenomenon. It is A. Arthralgia. Which of the following findings excludes the diagnosis of polymyositis? A. Neck muscle involvement. B. Extraocular muscle involvement. C. Dysphagia. D. Abdominal muscle involvement. It is extraocular muscle involvement which excludes the diagnosis of polymyositis. Which of the following condition is associated with normal anion gap metabolic acidosis? A. Cholera. B. Starvation. C. Lactic acidosis. D. Ethylene glycol poisoning. Now, in cholera, there is a normal anion gap metabolic acidosis. So, the correct option here is A. Cholera. All of the following are neurological channelopathies: episodic ataxia type 1, spinocerebellar ataxia type 1, familial hemiplegic migraine, hypokalemic periodic paralysis. It is spinocerebellar ataxia type 1. Most common identifiable cause of dilated cardiomyopathy is A. Alcoholism, B. Viral infection, C. Myocardial ischemia, D. Myocarditis. It is myocardial ischemia which causes dilated cardiomyopathy. Diagnostic feature in rheumatic heart disease is A. Aschoff nodule, B. McCallum's patch, C. Adenocarcinoma, D. alveolar cell carcinoma. It is Aschoff's nodule. A student unable to deliver the speech before the audience is suffering from A. Social phobia, B. Obsessive compulsive disorder, C. Agoraphobia, D. Claustrophobia. It is social phobia. Chronic lymphocytic leukemia is associated with A. Individuals more than 50 years of age, B. Mature small lymphocytes in peripheral smear, C. Hepatosplenomegaly and lymphadenopathy, D. All of the above. The correct answer here is D. All of them. Which of the following can cause delirium? A. Hypoxia, B. Barbiturates, C. Alcohol withdrawal, D. All of the above. In Marfan syndrome, aortic aneurysm occurs most commonly in A. Ascending aorta, B. Descending aorta, C. Abdominal aorta, D. Arch of aorta. It is ascending aorta. In Marfan syndrome, the aortic aneurysm commonly occurs in the ascending aorta. A patient has right upper limb BP of 180 by 95 millimeter of mercury and left upper limb BP of 130 by 90 millimeter of mercury. He also has early diastolic murmur in right second intercostal space. Which of the following would be least likely associated with these findings? A. Supravalvular aortic stenosis, B. Coarctation of aorta, C. Takayasu arteritis, C. D. Aortic dissection. Is coarctation of aorta. Aspirin sensitive asthma is associated with which of the following? A. Obesity, B. Urticaria, C. Nasal polyps, D. Extrinsic asthma. It is nasal polyp. Infertility in Cartagena syndrome is oligospermia, blockage of epididymis, asthenozoospermia, and descended testis. It is asthenozoospermia. Sleep apnea is defined as temporary pause lasting for A. 40 seconds, B. 30 seconds, C. 20 seconds, and D. 10 seconds. It is 10 seconds. Boys suffering from acute pyelonephritis, the most specific investigation is A. Histopathological examination, B. leukocyte stress test, C. Nitrite test, D. Bacteria and gram stain. This histopathological examination. 12 years old boy presented with gross hematuria with 80% dysmorphic RBCs 2 days after an attack of upper respiratory tract infection. The diagnosis is microangiopathic thrombotic anemia, B. IgA nephropathy, C. PSGN, D. Minimal change disease. It is IgA nephropathy. Which of the following is not a feature of extramedullary tumor? A. Early corticospinal signs and paralysis. B. Root pain or mid back pain. C. Abnormal CSF. D. Sacral sparing. It is sacral sparing. Treatment of choice for Kawasaki disease is A. IV immunoglobulin. B. Steroids. C. Mania. D. Schizophrenia. It is A. IV immunoglobulin. Borderline personality disorder is chronic feeling of emptiness, B. Unstable interpersonal relationship, C. Grandiosity, D. Low self-esteem. It is unstable interpersonal relationship. Indications of PCT are all except severe depression with suicidal risk, catatonic schizophrenia, severe psychosis, severe manic attack. Which of the following is the most specific test for rheumatoid arthritis? A. Anti-CCP antibody, B. Anti-IgM antibody, C. Anti-IgA antibody, D. Anti-IgG antibody. Do you think is the correct option here? It is anti-CCP antibody. Most specific for rheumatoid arthritis is anti-CCP antibody. True about tumor lysis syndrome are all hyperuricemia, hypercalcemia, hyperkalemia, hyperphosphatemia. It is hypercalcemia. The gold standard test for diagnosis of insulinoma is 72-hour fast test. B. Plasma glucose level less than 3 millimole per liter. Plasma insulin level more than 6 microunit per ml. C. Peptide level 50 pmol. The 72-hour fast test. Urine analysis of patient with hematuria and hypercalciuria are most likely to reveal A. Isomorphic RBCs, B. RBC cast, nephrotic range proteinuria, eosinophilinuria. The isomorphic RBCs. Most specific sign of metabolic encephalopathy is A. Asterixis, B. Abulia, C. Akinetic mutism, D. Apraxia. It is asterixis. Now let us quickly revise the MCQs once again. Which of the following is the most common extraglandular manifestation of primary Sjogren syndrome? It is arthralgias or arthritis. Which of the following clinical findings excludes the diagnosis of polymyositis? It is extraocular muscle involvement which excludes the diagnosis of polymyositis. Which of the following condition is associated with normal anion gap at acidosis, metabolic acidosis is cholera? All of the following are neurological channelopathy except spinocerebellar ataxia type 1. Most common identifiable cause of dilated cardiomyopathy is myocardial ischemia. Diagnostic feature in rheumatic heart disease is Aschoff's model. A student unable to deliver speech before audience is suffering from social phobia. Chronic lymphocytic leukemia is associated with individuals more than 50 years of age, mature small lymphocyte in peripheral smear, hepatosplenomegaly, and lymphodepathy. D. All of the above. Correct option here is D. All of them. Which of the following can cause delirium? Hypoxia, barbiturate, alcohol, bitter. All of the above can cause delirium. In Marfan syndrome, aortic aneurysm occurs most commonly in A. Ascending aorta, B. Descending aorta, C. Abdominal aorta, D. Arch of aorta. It is A. Ascending aorta. A patient has aspirin sensitive asthma is associated with nasal polyp. Infertility in cardiac Jones syndrome is syndrome. Sleep apnea is defined as 10 seconds. Boy is suffering from acute histopathological examination. 12-year-old boy presented with cross hematuria at IgA nephropathy. Which of the following is not a feature of extramedullary tumor? It is sacral sparing. Treatment of choice for Kawasaki disease IV immunoglobulin. Borderline personality disorder is unstable interpersonal relationship. Indications for ECT. Most specific test for rheumatoid arthritis is anti-CCP antibody. True about tumor lysis syndrome except hypercalcemia. The gold standard for diagnosis of insulinoma is 72-hour fast test. Most specific sign of metabolic encephalopathy is asterixis. So you can directly WhatsApp me on the above given number. You can join my 3-day ultimate masterclass. It will make your preparation easy so that you can easily, naturally, and automatically get a very good rank in your NEET PG exam. Wishing you all the best.